I'm Jim Check. You're watching KelownaNow. Today I have with me Terri Perepolkin, a fired healthcare worker from Vernon. And what was your occupation in the healthcare field?
I was a medical laboratory technologist.
Okay.
I worked out of Vernon Jubilee Hospital.
And you've been out of work now for how long?
About 2.5 years.
2.5 years.
Yeah.
And you're part of a lawsuit as well, or a class action suit?
Yeah, we formed a society, shortly after we got terminated and tried to bring in other healthcare workers that were in the same situation. And we have plaintiffs that are part of the lawsuit. So we're sponsoring the lawsuit.
Okay.
Yeah.
So how many people do you know that are still out of work?
That I know personally, yeah. I know hundreds in this area, but we have FOI requests that show that there's over 2,500 that were fired, but there were many, many, many more than that retired early or quit, which we can't
or
get
left
records.
Or whatever,
yeah,
right?
exactly.
So I guess the question is, most people would say, why are you still here?
Why am I still?
Yeah,
why didn't I go?
Why didn't you can go to Alberta? I take it, right?
Yeah, definitely could have. At the beginning, there was definitely a lot of thoughts for me and my family about moving. We could go to the States. We could go to Alberta. We wanted to stay here and keep fighting, right? And
I guess it's been a while. What's your mental state in this fight? It's got to be pretty trying.
It's been really hard. Yeah. I think it was about starting the beginning of this year. I finally started feeling good about where I'm at with my life. And we managed to pull our kids out of school. So we're homeschooling. We have a little property with gardens and chickens and that sort of thing, right? So for myself, I'm doing much better now. But many of our members and people that we know are still really struggling.
So how long had you worked in the healthcare field?
17 years, almost to the day. Yeah.
So you devoted most of your career up to now to that.
Absolutely. Yeah.
And I imagine you must miss it.
Absolutely. Yeah.
And then recently we're seeing, especially in the last 2 weeks, we're seeing closure after closure after closure in emergency rooms and stuff like that because of not the lack of thousands of healthcare workers, the lack of one or two, a doctor or a nurse and stuff like that. And we had a doctor on just recently as well, I think a couple of weeks ago, a doctor in Rutland that practices. He's allowed to practice in Rutland. But as soon as he refers a patient to the hospital, he has to orphan them. And for yourself, it's a little bit different. Most of your job would be with IHA or something like that, right? I take it.
Yeah.
It seems odd that we're still the only jurisdiction in North America, as I understand it, that has a provincial health mandate that you still have to get vaccinated for something that seems to, you don't have to get the booster.
Nope.
So the vaccines could be a couple of years old, and the reason you're supposed to get the booster, I understand, is that it was to keep the vaccine at a higher level. So it doesn't seem to make sense that you probably had COVID already.
Probably.
Most of us have had it. And you would have the antibodies. That's what the doctor told us, that he has it, and he sees no purpose for him to take it at this point. And then I think at this point, it seems more about a behavioral thing in my mind, that they want you to adhere to a behavior as opposed to a health reason for it. Because we also have patients in British Columbia that are getting, we don't have enough treatment for cancer patients, so we're sending them to Washington that does not have vaccine mandates. So it seems like it's okay to treat them across the line or in Alberta or wherever that is, but we're sticking to this vaccine mandate here, and it just seems odd.
Definitely, and it's nice to see that people like you and the people in the public are starting to see it now. It's something that we saw from the beginning. All of a sudden natural immunity was a conspiracy theory. Right. We knew it from the very beginning. We were fine to work in our positions before this vaccine came out. People were banging their pots and pans for us then. Yeah. But then the minute the vaccine comes out, they say, oh, well, you have to have it, right? And by that point, the majority of us had already been exposed to it.
Yeah. And I think we have enough technology, even if they can say that there is a risk that you could wear a mask, you could do different things, that there is enough layers of protection to end this vaccine mandate. And it seems like, how can the science be, I guess that's the question that must be running in here, how can the science be different in British Columbia than it is everywhere else?
I mean, at this point, I don't think it's about science. We didn't think it was about science from the beginning. It appears to
be... But even leaving the past behind, right? You know what I mean? Because we can argue about the past and they can argue about there, but what's the future is what I'm saying is, like, we can't fix yesterday. There's no way to fix yesterday. But we should look to the future, and we have hospital closures, and I see them, and they're painful. If you're telling somebody that has an arm cut off or something like that in a logging accident that they got to drive 450 kilometers because they don't have enough people in the rural areas, and the people with the least amount or the most resistance to the vaccine at the time is in interior health and in the northern communities, right? Because and these are the areas that suffer, and the Vancouver, and that they don't really notice it. I mean, that's the population of British Columbia. But how do we continue to allow people to have no services or long distance service when we have people like yourself, doctors and nurses and healthcare professionals that are ready to go back to work, and they're just being held out because of, I'm not sure what it is at this point.
Yeah, I don't know why they're not doing something about it. If this was at a hospital in Vancouver that they lost their emergency services, it makes you wonder if something would be done. But we actually know people in these communities, nurses who are emerge nurses who no longer can work because of the mandate, who would be happy to go and staff it, right? Yeah.
I know 5 people myself personally that are doctors and nurses that could be back at work. Or some of them are working in different fields right now,
right? Where
they could be back in, the IHA fold. We're putting out 2 stories this weekend. One in the interview with Shirley Bond, and one with the mayor of Merritt, who's is part of many of these closures, and he's trying to protect his people, right? And he's saying it's time to end it. And there was a petition from a bunch of mayors in northern British Columbia that had asked for it to end too. The bigger question that I have is, if this is not medical science, which it seems that it can't really be, if it's every other province and state, U.S. state has gone past it, then it's more of a behavioral thing that they're punishing the people that refuse to take it. Then I look to the stories that we do on a continual basis. Nurse caught, hitting a patient, nurse caught. Taking drugs from the dispensary and stuff like that. And they get a suspension of 2 weeks, 3 weeks. And it seems like if this is a behavioral issue that they're trying to address, you're getting a lifetime sentence with no parole. You know what I mean? Like, you're getting a lifetime sentence, as opposed to, like, here's your sentence. It's 2 years, it's 3 years or whatever, right?
Yeah, absolutely. And a big part of that is the fact that our unions really have done nothing to help us. We've found out through FOIs and stuff that the unions weren't even approached. The unions didn't even go to the employer and say, hey, why are you firing all these people, right? I mean, it's a lot different if they put people on leave and then could bring everyone back once the mandates were dropped, but they just...
We are going to reach out to the unions because unions are supposed to be put into place to protect the most vulnerable, right? So, and it seems like you're the most vulnerable right now.
Right.
And where is that layer of protection? You paid your union dues for 17 plus years, right?
Right.
And then it seems odd that the unions haven't raised their voice, because what science are they looking at as well, right? Because if this is the message that we got over and over and over again, it's about the science, right? And I think John Rustad came out today. There's a comment that he says, hire them back and fire Bonnie Henry. The response from David Eby was, why would we fire somebody that saved so many lives? And you can make that argument. And side with people that wouldn't do the right thing. But again, that's the past, right? You could make that argument, and you could say at that time we didn't have the information, we didn't know what was right or wrong, and you made a choice, you decided not to, and they made a choice, and they say go home. But that choice is no longer, I think, that is not a talking point anymore. And
we agree.
From what I look at, I don't see it as a talking point, especially when we're closing so many hospitals or emergency rooms in rural areas that are underserved to begin with. I can't reconcile it. And I've been trying. I had an interview with Dan Elbus a couple of days ago, and he said the federal government, when they assume, if they win, they will put pressure on. And
yeah, I wish that there would have been some pressure on them already for it, right? It's
John Rustad has come out and saying they need to be hired back, and he also said to be compensated. Kevin Falcon, the leader of the opposition, has said similar things. I don't think he said anything about giving them money back, but he did say they need to be hired back. We are doing a story with Shirley Bond. That'll go up, I think, either today or tomorrow. And we are one with and I'm trying to get the Merritt Mayor for an interview as well.
That's wonderful. We really appreciate that you guys are doing this, because there's very little media that's talking about it, and it's super important that we get our healthcare workers back to work.
Well, I mean, they lose the scientific basis when the doctor in Rutland can practice in his practice. Do you know what I mean? Like, he can serve 1,200 patients at whatever risk they're mitigating it somehow there, but he can't come into the hospital and work, and he can't refer patients. You know what I mean? He has to orphan patients at that time. That seems more of a political thing. Like, how do you defend that as medical science when it's okay over there but not okay over there?
He could also go in and visit his family members who are in the hospital.
Correct. Yeah.
Right?
Yeah.
I mean, it's about compliance at this point, right?
They were going to expand it because they were going to include all dentists and RMTs and everything. And there was such big pushback at that point that they didn't, right? Because there was going to be, because it was late in the game and people weren't, they were saying we're past the danger point, right? So, and I think that's the message that needs to be told. Arguing about the past can be done later.
Yes.
What's the path forward, and how best to serve British Columbians? And that's what our message is trying to do. We're trying to get out there and get the story. What's the best way to serve British Columbians today? And that is to put people back to work that we have. Like, we did a story that they're doing billboards across the United Kingdom, spending money and trying to recruit doctors and nurses from the United Kingdom. Like, you're taking them away from the United Kingdom, one thing, but we have doctors and nurses here ready to work.
Absolutely. It's a good start, right? It's a good start to, and the other thing is all of these people who got fired, they're skilled, trained, have everything. Exactly. It would be, such an easy way to bring people back. I mean, this is hoping that the majority of the healthcare workers will want to go back, right?
Yeah, I imagine, like I said, like, if we focus on the past, there'll be a lot of bad blood for sure, right?
Yeah.
Do you know what I mean? I think the only way forward is to say, you know what, like, we can argue about it later, but right now, British Columbians, there's many out there that are going without because of bad policy at this point, right? And definitely. It seems like, to me, like, it's bad policy because it doesn't, if it's medical science, then they're not doing it all the way through. And if we're sending people to Washington, it doesn't matter. You know what I mean? Like, it doesn't reconcile. And you usually should be able to reconcile something, right?
Right. And it's really nice because it seems like a lot of the public is starting to notice this too, especially because you guys have started interviewing people and putting out articles and stuff about this elephant in the room, that we have all these people here. But I think that now that the public knows about it, then maybe there will be a little bit more outcry, and we're hoping that we'll get the support for our group and the lawsuit that we're sponsoring to get these people back to work, right?
And I think a lot of people in your group were more reluctant to speak publicly too. Do you know what I mean? Because you've marginalized, minimized, stigmatized, whatever you want. I mean, that word, I hear it many times. I even hear it in our newsroom sometimes. They say, oh, they're anti-vaxxers. And I'm just like, stop using that word. Like, you know what I mean? Why are you using that word? Why would you want to, you're marginalizing or minimizing somebody because they made a choice, right? And you're saying they're not worthy to speak, right? And I'm sure that word hurts, right, when you hear that word?
Absolutely. There's been so much that has been said about us, and none of it's true. It's, all of the people that are involved in our group are amazing people, and we're very dedicated to their jobs, and we're just, waiting to make sure that this vaccine was safe and effective, right, which they kept telling us it was. And to get fired for making a medical decision is just...
You've taken other vaccines, I take it?
Absolutely.
Yeah.
Yep.
Do you have a family?
I do.
Yeah, you raise children?
Yep.
how are they dealing with it? That, you know, they must hear some stuff in school and stuff like that. So
They did. Our kids were in school through the majority of COVID, but after I got fired, I did pull them out of school because
protect them a little bit.
It was causing some problems, right? Yeah. Definitely. So my kids are great. They're doing wonderfully. My kids are vaccinated for all the other things, stuff, right? Yeah. I mean, I
mean, it's an unfair label because most people that refuse to take the COVID vaccine did their normal course of vaccines that have been around for a while, right?
The majority.
To say that, it seems it was a word that was to drive and divide and deride or whatever. What do you want? Like, what do you need?
What do we need from you?
Not from us.
Why am I here?
From British Columbia, what do you need?
Right. What we need is, so we formed our society 2 years ago, like I told you. We're not reaching everyone. Yeah. So we want to be able to support all the healthcare workers that are in the same situation as us. So we need them to contact us and let us know that they, want to be a part of our group. We also need to garner support from the public because we're here to get the healthcare workers back to work.
And I think you're only going to get that if you start speaking up in more than you. Do you know what I mean? Like everybody,
right, absolutely.
People like that. It took courage for that doctor to speak out because he thought, I'm going to get, I'm going to get fired. I'm going to get this. You know what I mean? But he said, it's enough's enough, and he was willing to, and he takes grief for it. And imagine you're going to take some grief for it, and we take grief for it. Like, you know what I mean? But at some point, it's just a bit of nonsense, right? And I would say there's a healthcare crisis right now in rural communities where closure after closure after closure, and how come they're not addressing this healthcare crisis when they have resources ready and able? And I think if they could park, and if you could park it as well, the past, and then move forward and say, okay, like we don't need to argue about who's right or wrong at this point. We just need to get back on with it and then try to have a better tomorrow.
Right.
And I think that if I was premier for the day, I would say that. You know what I mean? Like, I don't want to have that discussion today on who's right and who's wrong. I want to have a better tomorrow, and I want to make sure people are getting served, right?
It would be nice if the current government would do that, right?
So you do have the support of the BC Liberals, and you do have the support of the BC Conservative Party. I don't see anybody breaking rank even in the NDP. I mean, I don't know everybody, but I don't see that. The Canadian, you know what I mean? Like in the United States, many jurisdictions have actually even reported back pay and different things, and most people are back to work and said that these things were, unconstitutional and all those kind of things. And in the U.S., I'm not an expert in U.S. law, but I mean, we do see British Columbia as the aberration, right?
Yeah, absolutely. Even in Alberta, they laid off their healthcare workers because they had a mandate, and they were gone for, I think it was about 4 months. Right. And but those employees that got hired back 4 months later are now getting compensation through their unions. Their unions,
and they did terminate their top doctor too.
Yes, they did. And then we took her. Remember?
Right now, she works in British Columbia. Yes, she works with.
Is she still here? Is she still?
I'm assuming she is. Yeah. So. Is there more people that want to come out and talk, do you think? Or I know it's tough, and it takes courage for sure, right?
I think our lawyer would definitely love to.
I think we talked with him once before.
You may.
Yeah, we did a live stream, but that was with the employees union of the government. The ones that were actually working from home were still fired. You know what I mean? There's finance people.
Yeah.
Oh, that was that union, and lawyer. And I think maybe.
Yeah. No, I don't think his name is Omar. Have you guys interviewed him?
Yeah, I think so. On one story, I think. I don't know if we ever aired the interview. I think we did the story. I think we didn't air the interview. We did the story. There's too many things that were said in the thing. That's what I'm saying. We got to move past anger.
Yep.
And that kind of stuff, and leave the finger pointing later. And I think somehow reaching out to the unions too. I think we're going to do that. We're going to see what the unions have to say. I know they don't like to talk either, right? But
we can help you contact them if you.
I think that'd be a good part of that story, because like I said, we're gonna talk to the mayor. He's one of the communities that are suffering, right? And more, and even like I talked to one of the executive team for the Aspen Planers that just closed in Merritt, and they feel abandoned as well in the forestry sector, and I'm not feeling abandoned. Like, I mean, it seems like the focus of this current government seems to be the Lower Mainland.
Right.
And the rest of British Columbia can, like just make do.
Yeah, it's interesting that you were talking about the forestry sector and that sort of thing, because we actually just kind of merged up with the public servants. There's still, thousands of them that were fired for the vaccine mandate. It was different than the public health order, but anyways, there's still a lot of them that haven't been invited back to work, and we're, like you said, are seeing shortages all over. Correctional facilities is another one that I've noticed, right?
How are you making do, like financially? How is that going? Like,
we're doing okay. Yeah. So we, almost exactly a year ago now, we decided to sell our house and downsize. And
so you've made some sacrifices.
Absolutely, right? We, pulled our kids from their expensive dance class and found one that was more affordable. So we're, growing our own food in our gardens and that sort of stuff, right?
Anyway.
Yeah, and this is the thing, like I told you, is I'm doing a lot better now after all of it. But yeah, it's hard leaving your house you thought you were going to be in for the rest of your life and stuff, right?
So again, I go back to you've taken the punishment a couple years now, and also financial hardship and then emotional hardship. Yeah. When is enough for the NDP? I mean, that's a question. I'd love to have somebody on for the NDP. When is enough for these people that have been terminated? Like, when is enough? What is their sentence? Do you know what I mean? Like, what is it, right? Tell us a date, right? Is it 2030 they can come back to work? What date? What is that date? Because you give those suspensions out to people that do things that have behavioral issues, and then I don't think you can argue that this is anything other than a behavioral issue, right? In their mind.
Right. I mean, I feel like the fact that they terminated us rather than just
put you on leave.
Leaving us on a leave, it makes it kind of, set in stone as far as they are concerned, right?
A life sentence.
Right. And this is the thing, is at this point, it's, is it too late to get people back? I hope not. I hope that there's still people who will want to go back. But I mean...
Yeah, so I mean, how do you, like, even the skill levels, because obviously you have to adhere to ongoing professional development. How do you keep that up, and how far can you go before that, you're lapsed. You're lapsed, you know what I mean? Like, so nursing, doctors, you're in your field. And all that stuff, right?
I mean, I think that there would definitely be, a little bit of catch up for a lot of us, right? Most of the nurses, though, most of the nurses I know have been able to keep their licenses active, and to keep their license active, they have to do...
Well, they can work outside. Yeah, they can work in clinics, and they can work in...
Yeah, a lot of the nurses have still been working.
Yeah, I know some nurses that have worked in clinics and different, like cosmetic clinics or different types of clinics that are outside of the the management of IHA, which again makes no sense. They're actually seeing patients and dealing with patients. Yet, they just can't walk into a hospital. Yeah. So again, that alone, to anybody that wants to say that, you need to get vaccinated, like these nurses and doctors are working, right? And they are seeing patients. They're just not seeing them in the building over there. Right?
Right.
Do you know what I mean? Like that doesn't make any sense if you're running the healthcare system like that, you know what I mean? Like, because those walls don't have any like force field on them or anything.
Exactly.
Yeah. Anyway, this is kind of like silly. Anything else you want to?
Do you know what, Jim? I just want everyone to know that please contact us. We would like to hear from people of the public. We would like to hear from healthcare workers. We would like to hear from MLAs as well. Yeah. They can contact us through our website. And,
we have Ben Stewart on Monday to talk about this issue as well. So that's another one we're talking to.
That's wonderful. We really appreciate that support as well. But yeah, we would love to get a little bit more support from the public here to get through this.
How do they get a hold of you?
Through our website.
Okay, what's that?
It is unitedtogether.ca.
Okay.
I have a business card I'll give you on my way out.
Sure, and then we can put that at the bottom of the video, right?
Yep.
So
I appreciate that.
And anything else you want to add for today?
I just want to thank you so much for having me. It's, really important at this point. It's been 2.5 years since we've had thousands of healthcare workers sitting on the sidelines waiting to get back to work, and we're watching the healthcare crisis and all of the closures, and we just want to see our healthcare workers who are trained and fully capable of working get hired back so we can help the public.
I think there's an opportunity right now for Premier Eby to look at the healthcare crisis that's happening and all the closures and make a decision that they don't have to feel like they're backtracking. They can just say that this is now more important than this. Do you know what I mean?
Right.
They don't have to say they were wrong. They can just say the healthcare crisis in rural communities is more important now. And that's what Ontario and Quebec did, according to Dan Elmas. They weighed it and they said it's more important to do this now. So there's your out, Mr. Eby. You can just say this: the people in those communities are suffering more than what the protection this vaccine mandate that you're sticking to does. And that's I would say the message that many British Columbians should share.
We agree. We actually did invite all the leaders of all the political parties in BC to come and just have a chat with us. Right. And Mr. Rustad was the only one who responded to us. So he came and had a chat with our group. And it would be really nice to see some of the other ones wanting to come and just hear us out, right? Because this is exactly what we've been wanting to say to them.
I think if anything, I would say try to encourage the other people in your group to find the courage. We'll speak to them. And try to get other media to speak as well, right? And talk about a path forward instead of what happened. Do you know what I mean? Because we know what happened, right? And we can't change what happened, but we can talk about a path forward.
Yeah, absolutely. Thank you, Jim.
You betcha. And thank you for watching Kelowna Now.